Hello. So, I want to talk today for a moment about how interconnected we are, and I think especially while we're in the midst of self isolating, social distancing, I think this is a good time to bring this up. But before I do that, if you haven't seen my live feed about the difference between cleaning and disinfecting, I highly recommend you do that, especially right now. But just to take 3 minutes about that subject about cleaning and disinfecting. Remember that you need to clean first, disinfect second, that you can't disinfect something if there is debris or organic material present, we'll say like dirt. An example would be bleach does not work if it's a dirty surface, so that's why you clean first, disinfect second. Remember to that you're reading the label and diluting or reconstituting as is recommended for COVID 19. Okay. The CDC website has information about specifically, like for bleach, what the concentration is that you'd be using. And don't forget to be observant of the type of bottle you're putting it in. Bleach does not like light. So it's a good idea to put it under your sink, and I play it safe with all my disinfectants and cleaners. They all go under the sink. But the CDC says that it's once it's reconstituted or diluted bleach, it can last 2 to 3 weeks. I'm playing it safe, and every week I'm swapping it out with a clean batch. So just to keep those things in mind, I feel like it's a good place to start before I go anywhere else. And check out the video where I explain these things more in detail, and the links are provided with the video, with the CDC of that information. Okay, so let's move on from there now. So this is going to sound like I am getting political, and I want to make this very clear. I'm not. So some of the things I'm going to say is going to sound like that I'm aligning myself with a certain party or not aligning myself with others, and I want to make this very clear. That's not my intent. Approaching something from a public health perspective, and what I'm hoping is by us going through all these measures, seeing how interconnected all of us really are, that it gives us another point of view, an advantage point of, yes, what you do and what your neighbor does affect each other. Okay, so let's talk about this for a minute. So what does it mean, for instance, when your neighbor doesn't have internet? We've heard different times about how important it is that everyone has access to internet. Well, right now what this means is if you do not have internet, your children do not have access to school, right? There are millions of children out of school right now in the United States. So if you don't have access to internet, then your children don't have access to an education other than what you're able to provide to them with anything you might have in your home that's non-internet based if you don't have internet. It also means that you may not be able to access medical treatment. There were certain advantages put into play that, in my opinion, should have been put into play a heck of a long time ago, but for telemedicine. Because we don't want people anytime, even outside of this, we don't want people to go into a doctor's office or emergency room that doesn't need to be. Because when we go into those places, we go into those places with other sick people, right? That's not just now. That's how it's always been. That's always been the recommendation. But now with telemedicine, we're keeping sick people home. Well, what if you don't have internet? Then you don't have access to that advantage. And you may either expose other people to something, or you may be in turn exposed by not having access to that. What about employers without sick pay? What is that? Has that done to other people? That means people stayed longer at work than what they should have been, right? That means you're looking at it, you got to feed your kids. So either you go to work and you get paid and you take that risk, or you stay home and you mitigate the risk with exposing them to illness, but you cannot feed your children. So employers that do not offer sick pay does affect the rate of disease transmission. That's what we're seeing now. That's why we're being ordered to stay home. That's why unemployment is expanding and so on. What about people that don't have health insurance? Now, for a heck of a long time, that's always been a concern for me. And I look at it from a public health perspective. When one person doesn't have insurance, it's a potential risk for everybody. It's not just for that one person. And it's not only people that are unemployed that don't have access. We got to keep this in mind. There are many employers that do not offer health insurance, even to people that are full-time. So what happens then when you have a large percentage of population that are uninsured? What does that mean then? That means when they're sick, they're not going to the doctor. That's a concern, especially when we're talking about something that is infectious. They're not seeking treatment. It's also another concern. Let's say it's outside of this realm. COVID-19 is not happening. We're not worried about necessarily an infectious disease. What does that mean? Well, that means that what we're also concerned with, let's say that person doesn't go for treatment, and it could have been something that was something pharmacological, a medication it could have been given, or of easy treatment. But now, because they weren't able to seek treatment, now it's turned into a very expensive surgical procedure or very expensive pharmacological or medication intervention. When a hospital doesn't get paid, they don't just write off that bill and go, oh, well, that gets passed on to everybody else. So person not having insurance doesn't just affect that person. It affects the health of a community or niche, and it also affects the cost of healthcare. Okay? So let's talk about families not having a living wage. This kind of connects to that point of saying that if it's a situation where they don't offer sick pay, if they don't have a living wage, then people unnecessarily expose themselves and their families to work. We typically, and we should be telling people, if you are sick, do not go to work and do not go to school. That's what we should be promoting. We can't honestly do that if people can't afford to stay home. As an example with kids, if a parent cannot afford to stay home from work to care for that child, then some parents will send their children to school sick. That's not judgment. I'm not going to judge that. I think the point I'm making with this is when you can't afford to stay home, what happens? If you don't have a living wage, what happens? All of these things, we hear about it, especially when it's election time. It's being said in a way that's, and I'm going to put this in my personal opinion, that it's incredibly dumbed down. Like all of these things are completely separate from each other. As a public health professional, I'm telling you they're not. And what we're seeing now with everything that's taking place is everything's hitting the fan simultaneously. We're seeing living wage matters, insurance matters, people not having sick pay matters, not having internet access. All these things that we've been told and we've talked about for decades and decades, that all this stuff is just separate from each other. Doesn't mean anything because it's just a family that's not having a living wage, or it's a person that doesn't have health insurance. And now we're seeing, wait a minute, it's millions of people that don't have access to those things. And when we don't have access to them, it affects the health and welfare of an entire country. We are only as strong as our weakest link. And I'm speaking of health. Again, although this may sound like I'm going political, I'm not. Politicians have made this political. But to keep our communities healthy, these are the things we have to keep in mind. We are all interconnected. None of us live on an island, and none of us do anything that doesn't affect somebody else. Okay? And then one last comment to make here. And I'm honestly hoping that those of you that are seeing this, comment. Okay? The spot right down here has a comment. Comment. Questions. Talk to each other. Because this is something that has always surprised me, and it's definitely come out in the last about 3 or 4 years now. It's this idea of a country being able to isolate itself. Now again, I'm only speaking in terms of health. Okay? This is not a political issue to me as a public health professional. This is a health issue. So right now, we have a disease that originated from the other side of the globe. Now, I'm not pointing my fingers, and that's a whole nother conversation to what we can learn from the actual spot of that spillover event, that event from spilling over from animal to person. That is a learning event as well. That is definitely a public health event. I'm not even going down that road with this video. I'm talking about something happening on the other side of the globe and how it affects all of us. It used to be, hundreds of years ago, it was the wealthy people that traveled. It took weeks to get somewhere. This was not, disease was for the most part isolated to areas because of how long it took to travel, because of who went there, and so on and so forth. Today, that's not the case. Most of us can get on a plane and go anywhere in the world. Now, that also means not only can we take disease with us, but it also means we can bring it back. So the decisions we make about trying to isolate ourselves as a country, and again, I'm speaking public health, isolating ourselves as a country, the decisions we make that say, oh, I'm not going to help another country because, see, that has nothing to do with me. We can't say that anymore, that we cannot see that how it affects us. I hope that this discussion will continue and that we come to that understanding. Unfortunately, we may be coming to that understanding in a form of watching our friends and loved ones become ill. We might ourselves be someone that's recovering from this virus that may make us, give it a different perspective. But nonetheless, this is something we all should be discussing and really trying to get an understanding of the fact that what we do here, what's done somewhere else, it does affect us. And it does not help our health to try to ignore how interconnected that we are. So why am I discussing this now? Really for us to give it some thought. Really to try to think about the fact of, if you're told to stay home, people, stay home. We've all been receiving orders about staying home, do not go out if you don't have to. If you go out, you can affect the health and welfare of someone else in your household or outside your household. So stay home. Wash your hands. If you are sick, do not go into the emergency room or the doctor's office. Call first. You don't want to be that person sitting in a waiting room and infecting other people. Or that you're sitting in a waiting room and you pick up something else from someone else. Okay? So let's follow all these guidelines. Let's use cleaning and disinfecting procedures that we should be using in our homes, on our clothing, on our cars, and so on, so that we reduce transmission not only for us, for our homes, our families, our loved ones, but for other people within our community as well. When we all work together and we all see how interconnected we are, we'll get through this a heck of a lot faster. Okay? So don't forget, comment, question, share, send. If you feel like there's something that needs to be said, let's keep this communication going. And I look forward to a next video or live feed. Bye.